BTOG has been an amazing conference once again, and it's a superb platform to provide the details of our research here in Belfast on radiation heart disease. Cardio-oncology is a really hot topic across oncology at the minute, and it's really important in lung cancer as well, of course. There's so many unknowns, but we're starting to collect that data, and our patients are keen to participate in that research as well, which is brilliant. Ultimately, what we want for our patients is really good holistic care. We want to make sure that their cancer is cared for in the highest quality way possible, but also that we don't forget about the rest of the body and look at the other parts that are important. So cardiac disease is rife in the modern era, and there's lots of reasons why that's the case. But I think in lung cancer we've got an opportunity to really look at our patients' baseline cardiovascular health, optimize that, and that hopefully will reduce the risk of cardiac problems after their treatment. I'm a clinical oncologist, so I'm particularly interested in radiotherapy side effects. We see patients having exacerbations of heart failure, we see patients having new arrhythmias, we sometimes see ischemic events like heart attacks after radiotherapy as well. Now, what we're starting to learn is that potentially some of the cardiovascular risk factors and maybe established cardiovascular diseases before radiotherapy, they are probably important in terms of that story of that patient, whether or not they go on to have heart problems afterwards. As a clinical oncologist, I'm really pushing to get the best of my patients in every way, so I'm really interested in trying to tease out what else extra things we can do for our patients to make sure they're as strong as possible for our treatment and therefore strong as possible after treatment, and have as much access, as many treatments as possible, and a maximum quality of life for as long as possible. Some things we'll be looking at in a quantitative way, so looking at echocardiograms and ejection fraction of the left ventricle. That might be able to tell us about a patient's future risk of having a cardiac problem after the radiotherapy. That's not something we usually do as sort of standard, but for those patients that do already have it done, it can be insightful about that patient. Likewise, blood tests such as BNP may be informative. The work we've done in Belfast on a 500 patient cohort over sort of 6 years follow-up, it has been really interesting. It's retrospective data. It's still under review at a journal, so it's not peer-reviewed yet, but we're hoping this will begin to knock off that chain of dominoes to start getting everyone around the country and globally interested in how can we assess the heart at baseline in these patients who need radiotherapy for lung cancer. Then beyond that, there's new European guidelines from the European Society of Cardiology on cardio-oncology for the first time, which is very exciting. Gives us a new chance to benchmark our current performance and also plan how we'll go ahead in the future with our next sort of levels of testing and investigations. And I think this data that we're developing here in Belfast will hopefully feed into the future guidelines, and we're really interested in networking and working with people here at BTOG and at Estro and other conferences in the coming months to try and really pull together our different resources in different hospitals, different interests, cardiology, oncology, both clinical and medical, and radiation oncology, and radiologists as well, try and come together and work together to get really important, meaningful projects together that will lead to better cardiovascular outcomes for our patients.